I'm going to demonstrate how to withdraw medication out of an ampule and then administer that medication subcutaneously. So first I have my BSI on and our scene is safe, so I have gloves and goggles on. And I'm going to explain the procedure to the patient, let them know that we're going to inject them with a medication. We're going to go through our 5 patient rights, so write patient, drug, dose, route, and time. And we're also going to check for any allergies with the patient and dice our medication. So for this scenario, we'll say that our patient's having an allergic reaction and we're going to give epinephrine subcutaneously. So dicing this, we have epinephrine as our drug. The dose we're going to give is 0.3 milligrams. And the integrity of this package looks good. There's no breaks in it. And the concentration is 1 milligram per ml. The clarity looks good. And expiration date is 11 of 2018. So we're going to go through our equipment. We have a filter needle, which we'll use to withdraw medication out of the ampule. We need this specifically because broken glass shards could be inside of the medication. We need to filter them out. We have another needle for administration. This is a 23 gauge 1-inch needle. And you can use anywhere from 23 to 26 gauge and between half an inch and 1 inch. We're going to use a 1 ml syringe because we're going to withdraw less than 1 ml of fluid. And we have some gauze and a Band-Aid. So going through our medication here, you can see at the top of the vial, sometimes the medication can get stuck up there. So we need to get that medication down into the bottom so we can withdraw it. So there's a few different methods you can use. First, you can take it between your hands and just simply roll it, and it'll drop the medication down. You can also just flick on it, and that'll get rid of it. Or you can grab it by the tip here and make a circular motion, and that'll also take out the fluid. So when we're actually opening this up, you're going to need an alcohol prep pad. So open up just the top of it, and what you're going to do is put the tip of the ampule inside, and we're going to break this away from us because the glass can sometimes fly off of it, and you should expect it to break here on the neck. So use your thumbs, use a little bit of pressure and break, and you can throw the top directly into the sharps. And now we can have our syringe ready here. And we're going to attach the filter needle. So you twist it, take off the cap. Make sure it's attached firmly. And in this case, we're not going to pull any air into the syringe. We don't want to push air into the ampule because it'll cause the fluid to come out. So have your plunger all the way at the top. Now there's a couple different ways you can actually pull out the medication. You can sit this on a flat surface and simply put this down into it and withdraw. But if you're in a moving ambulance, that could be difficult sometimes. So what you can also do is flip this upside down just like you would with a vial. So flip it quickly, and you'll see that the fluid is just suspended there at the base. So hold it at an angle like you would with a vial, brace your hand, and insert your needle without putting any air in. And you want to just inside at a little bit of an angle and start withdrawing. All right, I'm withdrawing here just until I get to 0.3 because that's the dose we're going to give. So I'll pull back until a little bit past 0.3 because I'll have to expel a little bit of air. Okay, so I will go ahead and sharps this. And there's a little bit of air in there, so I'm going to zero it out to 0.3. Okay, now we're going to discard the filter needle, so we'll throw that directly in the sharps. And I'm going to attach my administration needle, which was the 23 gauge 1-inch needle. And now that's ready to administer. So we're going to pick a site here. So we want to inject it into fatty tissue. So typically we're going to go at the back of the arm in the triceps area. You can also do around the abdominal area if you need to. So we'll assume this is a tricep. And what we're going to do here is clean the site first. So grab an alcohol prep and clean starting in the center, work your way out, concentric circles. And unlike with the intramuscular, we're going to pinch the skin and try and lift up that subcutaneous fat so that we don't go into the muscle. So we're going to pinch that up and hold it there. And we're going to inject at a 45-degree angle. And you can see on the end of the needle here that there is a bevel. So we want to have that bevel facing upward. Okay, so warn your patient, let them know you're about to inject. We're going to pinch the skin, 45 degrees, bevel up, and quick darting motion. We're going to stabilize the needle there, and we're going to give that entire 0.3 milligrams. Grab your alcohol prep, pull out the needle. We're going to push up on the safety mechanism to lock it, and we can discard this in the sharps. Massage in the medication, grab your gauze, control any bleeding, and we're going to reassess for desired effects and reassess for any adverse effects.